Well, with the bias of being a urologist focused on localized muscle-invasive bladder cancer and non-muscle-invasive bladder cancer, I think two of the most important trials have been ALBAN and POTOMAC. These are trials for BCG-naive, high-risk, non-muscle-invasive bladder cancer patients, and these two trials combine BCG induction plus maintenance with systemic immunotherapy, atezolizumab in the ALBAN trial, durvalumab in the POTOMAC trial versus BCG induction plus maintenance. We have seen that the POTOMAC trial has been positive with a statistically significant difference, has a ratio 0.68 for those patients who receive the combination, and whereas the ALBAN trial has been negative. We also have the history of a recent positive trial, which was the CREST trial, same has a ratio 0.68 for patients receiving BCG plus Cetrelimab, and this was reported at AUA in Las Vegas last month of May. And then I will also highlight the final results of the Sunrise-4 study, where we see that in the localized muscle-invasive bladder cancer scenario, when we use Cetrelimab as a neoadjuvant systemic therapy, the addition of TAR-200 to Cetrelimab significantly increases the rates of complete response, pathological complete response, until 38%. So in the future, I think many of other trials which are running are going to report their results, and we have exciting times ahead for our bladder cancer patients.